Leaving the hospital can be both exciting and stressful. Whether it was a long or short hospital stay, there is often some degree of apprehension about the discharge process. If there is ongoing care needed after a hospital inpatient stay, a discharge plan should be developed and shared before the care recipient leaves the hospital. The discharge plan is also sent to the family doctor, although it can take some time to reach them. If there are any outpatient tests prescribed, advocate that your family member or friend stay at the hospital for most of those tests. Because after they are discharged from the hospital, it can be difficult trying to book all the appointments yourself. It also may be a challenge taking the person for outpatient tests by yourself, especially if you are a caregiver of an elderly person or someone with mobility issues. Discharge from the hospital may be to any of these places: home, with or without home care, long-term care home, rehabilitation facility, complex continuing care facility, palliative care. The patient's care team generally determines any post-discharge care needs. Making these arrangements is done in conjunction with the patient and the patient's caregiver, who should already be included as part of the care team. It can take quite a bit of research to decide which option best fits your needs. Sometimes after a hospital stay, patients may need additional time to recover before they can go back home. For example, patients may be referred for rehabilitation or rehab services, where they can receive therapy to try to regain abilities they may have lost or to help maintain function. Rehabilitation services are provided in various settings, such as inpatient rehabilitation hospitals, nursing homes, specialized rehab units within hospitals, and other specialized settings. The caregiver needs to confirm that before a discharge happens, the healthcare team has arranged for care to be in place. When being discharged home, make sure you have access to necessary equipment, supplies, and additional services such as home and community care. Meet with the hospital or rehab staff to be clear on instructions for care at home. It is also important that you inform the medical team about what you can or cannot do for your care recipient and what training you may need. Find out what symptoms and behaviors are to be expected. On the day of discharge, you should be given a discharge summary or package. A useful resource to help you at a time of discharge from the hospital can be found at the Ontario Caregiver Organization's website, linked in the description box below. A follow-up appointment with the family doctor after a hospital stay is frequently recommended. Discharge plans are sent to the patient's family doctor. However, they may not receive the information before the follow-up appointment. It's recommended to take the discharge plan, including the up-to-date medication list, with you to the appointment. There are many challenges related to when patients need to go to a long-term care home. This can happen suddenly, and as a caregiver, you may not have enough time and resources to handle the situation. That's why it is important to have close communication with the hospital attending physician to get an idea of when the care recipient may be discharged so you can plan ahead. Home and community care support services care coordinators are the ones who do the assessments to see if a person qualifies for the type of care provided in a long-term care home. They are also the ones who manage the waiting lists for long-term care. Normally, when a patient or their caregiver is considering applying to a long-term care home, they can choose up to 5 homes to be waitlisted for. Nursing homes in Ontario, both private and not-for-profit, have long waiting lists, so patients may not be able to move to their preferred long-term care home right away. Alternate level of care is used in hospitals to describe patients who occupy a hospital bed but do not require the intensity of services provided in that care setting. Staying in a hospital longer than is medically necessary and being designated as alternate level of care can have negative effects on the patient, through risk of hospital-acquired infections and functional decline. Effective November 2022, the government passed what may be a temporary amendment to a regulation under the Emergency Management and Civil Protection Act. The amendment allows doctors to transfer ALC patients out of hospitals experiencing surges. These transfers may be to a long-term care facility that's not the patient's first choice, potentially far away from family members and loved ones who play a critical role in their day-to-day care. To help navigate these and similar caregiver resources, visit the East Toronto Health Partners Service Directory. The link can be found in the description box below this video. For more information on navigating the healthcare system for your care recipient, watch our other navigation guide videos.